There's very good evidence from published studies that hospitals that are engaged and active in research have better outcomes for their patients. That's not just for the patients taking part in the research, but for patient base as a whole across the whole hospital. For those patients who are involved in research, they tend to have better confidence, more increased confidence in the staff looking after them, and they tend to understand their medical conditions better, better equipped to be able to cope with some of their illnesses, particularly with chronic diseases. Patients who are involved in research studies may have access to new treatments, new drugs that might not otherwise be available to them. In some clinical specialties, such as haematology, being a participant in research studies is the only way to get effective treatment for some of the haematological malignancies that are treated currently. Our vision is to develop the Trust as a research centre of excellence and to try and embed research into everything that we do within the Trust and to filter it down to all levels. We want to put together a high quality agenda of research within the hospital. That will come about as a result of increasing capacity within the Trust, so we need to increase the number of research approved NHS portfolio studies and commercial studies. But we also want to develop our own researchers to come up with their own research studies and to address the clinical questions that are important to our population base here at Doncaster. The other aspect will be to embed research culture across the Trust and to try and engender our staff at all levels to think critically about patient care and to try and adopt best practice standards and evidence-based research. So that's taking the results of the research that we're involved with and research studies from elsewhere, processing those and feeding them back to staff so that we can deliver the high quality care that our patients deserve. So what have we achieved to date? Well, in the last 10 years we've built up a very strong and effective research department and they've built up a lot of expertise and they've built up a strong reputation within the region. And we've also built up some strong researchers within the Trust who are very active as well. But in trying to move the agenda forwards and spread research out across all areas in the Trust, we've been very busy in the last couple of years. So we already have a Professor of Surgery who's been very involved in promoting postgraduate research within the Trust and developing some homegrown research projects. But we've now appointed a Professor of Nursing and Allied Health Professionals this year, and she's been very busy trying to promote the agenda of research in nurses and allied health professionals. We couldn't do this without our local partners, and we've been doing a lot of work strengthening our ties with local partners such as Ardash, the University of Sheffield and Sheffield Hallam University, Shah at Sheffield, as well as other local trusts in the region, as well as increasing the number of postgraduate researchers within the Trust. We've also started taking on some undergraduate researchers in the last couple of years. So these are medical students from Sheffield who are taking time out of their normal studies to do research projects. And in the last couple of years, we've had quite a few consultants within the Trust come forward with research projects and have mentored the researchers of tomorrow from the University of Sheffield. The other major thing we've achieved this year, we've opened the Research and Academic Hub here at Doncaster Royal Infirmary. So this is a base where we can meet and greet external clients. So the room from which I'm speaking at the moment is our main meet and greet room for external partners. But the research space is also there to be used for conducting research and doing interviews with patients. And there's hot desking space for researchers to be active in teaching rooms as well. And that's a fantastic resource that's being very well utilised since it opened a few months ago. We recognise there's an awful lot to do. We do need to increase the capacity for research, and that won't happen overnight. But we're looking at innovative ways of being able to take on more research studies As we take on more studies, particularly some of the commercial studies, that might bring in a bit more income and help us grow our research base. We have some fantastic researchers within the Trust, but we're always looking out for new and interested researchers. So this includes consultants as well as SES doctors, but also nurses, midwives, allied health professionals. We have a lot of physiotherapists that are engaged in research, and we're hoping to expand our base. As we expand our researchers, we're hoping that they'll come up with their own ideas and their own projects, and we want to support researchers in doing that. And it's hoped that we can grow some of our research into perhaps putting in bids for big research grants from NHS and NHIR. And that will really cement our reputation as a strong research trust, as well as support us financially. And finally, we need to work at our dissemination of research outcomes and make sure those are filtered out to all levels within the Trust, so that all our employees from the ground upwards through nursing staff, doctors, everyone engaged with patients is aware of the research and the important contribution that it's making for our patients and supporting patients in taking part.
Hi, my name's Kerry and I'm research midwife here at the Trust, and I'm also the Baby D midwife, and that's the study I'm wanting to give you more information on today. It's born and bred in Doncaster, or Baby D for short. It's a groundbreaking study and it's the largest study we've ever had in the Trust. We'll be giving all pregnant women in Doncaster the opportunity to take part. It's a data linkage study, so what that means is that we'll be asking women to consent to us, or health researchers accessing information about them and their babies across services. So not just here in the NHS, but also, for example, GP services and education as well. And the reason we're doing that is that we know studying babies from before birth and linking that information between women and their babies and across services will give health researchers a better understanding of people's lives here in Doncaster, and it'll help us understand why some families stay healthy and others fall ill. The information can also be used as a health intelligence tool locally, so it can help us decide where we want to put more services, so it'll help us shape services, and it can also help us decide where we want to put further investment as well. So Baby D is part of a larger network of baby sites, or other baby sites, and collaboratively together that information can be used as a meta cohort, so a vast amount of information can be used to answer any research questions of national relevance or common interest. So here in Doncaster we launched a pilot study on the 10th of June with the help of the Community Midwifery East team. They're doing phenomenally well. So far they've recruited 28 participants to the study, including our first Baby D babies. So I'd like to thank them for all of their hard work in getting the study off to such an amazing start. And I'd also like to thank the women of Doncaster for consenting to be part of the study and supporting the study, which will ultimately help to reduce health inequalities for the families here in Doncaster.
Hi everyone, my name is Paveen and I work here at DBTH and the University of Sheffield as Professor of Nursing and Gender-Based Violence. My job here at DBTH is to make sure that the care we provide to people is evidence-based and research-based, and that our nurses, midwives, allied health professionals, and clinicians are able to not only understand the current evidence, current research, but also to contribute to research and to engage in research and to use that evidence into their current practices. We do various different things around that. And just few examples are that how do we make sure that research is embedded at every level of the organization, and that people who are doing research, especially nurses, midwives, and allied health professionals, are not only engaging in research at every level, but also have got a very clear career structure and are also aware of how generating evidence and bring the evidence into their work is essential, and how can that made be practical. And all of that is done to ensure that best possible care is provided to the patients and communities that we serve. So I hope that has helped. Thank you very much.
Hello there, my name is Rebecca Pugh. I'm the Senior Research Sister for Doncaster and Bassett Law Teaching Hospitals. I'm going to talk to you today about our current research activity within the Trust. We currently have 48 portfolio research studies running. 6 of these are commercial research studies, and we've got a further 50 studies in patient follow-up. COVID has provided a really good platform to raise the awareness of research. Research activity has really increased within our specialty areas. We currently have research going on in 26 specialties throughout the Trust. We are really committed to offering the opportunity of research to our patients, and also committed to offering the opportunity to participate in research for our staff members also. I'd like to invite you to watch Anne's story. Anne was a former research patient on one of our research studies who would like to share her positive experience of being involved in research.
My name is Anne Rutherford. I am 66 years old and suffer from heart failure and COPD. I have life-limiting ailments and have taken part in trials to help find medications or treatments that could enhance my life. I joined the research trial Ironman to help them with the study. We do not use drugs in this trial that have not been used before, but to see if they have a multifaceted use and could help improve my quality of life. From the consultant to the nursing team, they are always there to support you and answer any questions you might have, and to explain in detail the aim of that particular trial you are on. Our participation is needed so the teams see and monitor the difference in reactions to the treatments and or procedures being trialled. This is a very important part of research, and to think we could better our standard of living and quality of life by becoming part of research to help ourselves or others is all the incentive I need for taking part. If he could do that when he was so very, very ill, then why can't I just take part in other things that would enhance my life and other people's lives if I could possibly do it? The support that you have from the team is fantastic. They're never ever far away at the end of the phone. You work as a family kind of thing. That's what you've got. But they certainly helped me with my life. It's really helped, and it did help my husband too. So, yeah, all power to our elbows, that's what I say.